Welcome back to Clean and Green Tips. Here we make health and wellness easy and fun with simple tips so you can take care of your body without getting lost in technical terms. Have you ever wondered if the medications you're taking could be secretly harming your memory and brain? It might sound surprising, but some everyday medicines could be doing more harm than good when it comes to your brain health. In today's video, we're diving into 8 common medications that might be affecting your memory, focus, and overall brain function. These are pills that many of us take regularly without even realizing the potential side effects. For years, people believed that losing your memory as you age was just part of getting older. But here's some good news. Memory loss isn't something you just have to accept. Recent studies show that memory decline isn't a guaranteed part of aging. Instead, it's often caused by other factors like diet, lifestyle, and yes, even certain medications. This means there's a lot you can do to protect your brain and keep your mind sharp as you age. It turns out that factors like smoking, excessive alcohol use, poor sleep habits, and prolonged stress can all accelerate memory problems. But what might surprise you is that some of the medications you take for everyday issues, like heartburn, anxiety, or even allergies, could also be culprits. In this video, we'll uncover which of these medications pose risks to your brain and how you can manage your health more effectively. Heartburn medicines. Heartburn and acid reflux are no fun, right? That's why so many people rely on medications like omeprazole to keep the burn at bay. These drugs, known as proton pump inhibitors, PPIs, work wonders for reducing stomach acid and providing relief. But did you know that using these meds for too long can hurt your brain? Several studies have found that prolonged use of PPIs can lead to memory problems and even increase the risk of dementia. For instance, one large study found that people who used these medications for more than 3 years were more likely to experience memory loss. It's believed that these drugs might interfere with the absorption of important nutrients like vitamin B12, which is essential for brain health. If you're taking these regularly, it's a good idea to talk to your doctor about how long you should keep using them, and explore alternatives like lifestyle changes or different treatments. Medications for bladder and breathing problems. Next up, we have a group of medications called anticholinergics. These are often prescribed for conditions like overactive bladder, Parkinson's disease, and even some respiratory issues. While they can be really effective for these conditions, they also block a brain chemical called acetylcholine, which is super important for memory and learning. Research has shown that long-term use of these medications can lead to a higher risk of memory problems and dementia. One study even found that people who took high doses of anticholinergics for several years had a 59% higher risk of developing dementia. If you're on these meds, make sure to check in with your doctor about whether they're still the best option for you, or if there might be safer alternatives available. Before we go on, if you're finding this video helpful, please give us a thumbs up and subscribe to Clean and Green Tips. Your support helps us bring you more content like this to keep your brain and body in top shape. Steroids are powerful medications used to combat inflammation in conditions like asthma, allergies, and arthritis. These drugs, such as prednisone, are lifesavers in many cases, but they come with a catch. Long-term use of steroids can mess with your mind, leading to memory loss, mood swings, and even confusion. This happens because steroids can alter the levels of cortisol, a stress hormone in your brain. While cortisol is important for managing stress, too much of it can damage the hippocampus, a part of the brain crucial for memory and learning. So, while steroids can be extremely effective, it's important to use them cautiously and under close supervision from your healthcare provider. Anxiety medications, benzodiazepines like Xanax and Ativan, are commonly prescribed for anxiety and insomnia. These medications are very effective in calming your nerves and helping you sleep. But there's a downside. Long-term use can lead to serious memory problems and increase the risk of Alzheimer's disease. Studies have shown that these drugs can interfere with the way your brain processes information and consolidates memories. Over time, this can lead to cognitive decline. If you rely on benzodiazepines, it might be worth exploring other ways to manage anxiety and sleep, such as cognitive behavioral therapy, mindfulness practices, or even natural supplements. ADHD medications. If you take medication for ADHD, attention deficit hyperactivity disorder, a condition that affects focus and self-control, you know how much it can help you concentrate. These medications, like Adderall, boost levels of certain chemicals in the brain that help with concentration and attention. However, prolonged use can lead to some pretty serious side effects, including memory problems and even potential brain damage. High doses or long-term use of amphetamines can alter brain chemistry and may result in decreased motivation, mood swings, and cognitive difficulties. It's essential to use these medications strictly as prescribed and to have regular checkups with your doctor to monitor any potential side effects. Allergy pills. First-generation antihistamines like Benadryl are often used to treat allergies and colds. These medications can be very effective in providing quick relief from symptoms like itching, sneezing, and a runny nose. However, they also have a dark side when it comes to brain health. These older allergy medications block acetylcholine, a neurotransmitter that is crucial for memory and learning. This can lead to memory problems, especially with long-term use. Today, there are newer antihistamines that don't carry the same risks, so it might be worth asking your doctor if you can switch to one of these safer options. Older antidepressants. Tricyclic antidepressants, like amitriptyline and nortriptyline, were some of the first drugs developed to treat depression. While they can be effective in improving mood, they also have significant side effects, including memory loss. These medications affect the balance of neurotransmitters in the brain, which can interfere with your ability to form and recall memories. Additionally, they can cause a range of other side effects like dry mouth, constipation, and blurred vision. If you're taking these older antidepressants, it might be worth discussing newer options with your doctor that are less likely to impact your memory. Cholesterol medications. Statins, such as Lipitor, are commonly prescribed to lower cholesterol and reduce the risk of heart disease. They're incredibly effective at protecting your heart, but there's some evidence that they might not be so great for your brain. Some people who take statins have reported issues like memory loss and mental fog. The connection isn't fully understood yet, but it's believed that statins might interfere with cholesterol production in the brain, which is important for healthy brain function. If you're on statins, it's important to monitor any cognitive changes and discuss them with your doctor. Sometimes, adjusting the dose or switching to a different medication can help alleviate these side effects. Medications play a crucial role in managing many health conditions, but it's important to be aware of their potential effects on your memory and brain health. Always discuss any concerns with your doctor, and never stop taking a prescribed medication without medical advice. Remember, protecting your brain is just as important as taking care of the rest of your body. Thank you for joining us today on Clean and Green Tips. Don't forget to subscribe to our channel for more health and wellness videos. Wishing you great health, wealth, and happiness. See you in the next video.